I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, would you please call the roll?
Alderwoman Green. Alderman Gunther.
Here.
Alderwoman Martin. Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingrassia.
Present.
Alderwoman Green. Alderwoman Martin. 5 present, you have quorum.
Thank you, Madam Chair. If anyone on the committee has had an opportunity to review the minutes from Tuesday, November 9th, I would entertain a motion to pass those minutes.
I'll move to approve the minutes from, what day was it again?
November 9th.
November 9th. Second.
Madam Clerk, please call the roll.
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingrassia.
Aye.
6 aye votes.
Thank you. We are going to move the agenda around a little bit today, and the first discussion we're going to have is on Resolution 141. Alderman Stevens.
Thank you, Madam Chair, members of the Health and Human Services Committee. Madam Chair, if I start to break up or get a little laggy, would you please interrupt me? Perfect. Thank you. Dear colleagues, members of the public, today I introduce Resolution 141 to the Health and Human Services Committee for consideration and for hearing. Resolution number 141 is simply a declaration of our fundamental reproductive freedoms. And what immediately comes to mind is abortion, right? That is the hot ticket item. Here in the United States, as a Supreme Court, here's the Texas law. And this is merely the Board of Aldermen maintaining its stance that it has maintained for a while. And Madam Chair, as a point of order on myself, was I meant to motion to introduce the bill before launching into my introduction of it?
No, I recognized you on the resolution.
Okay, thank you.
So
So sorry. I get caught in the parliamentarian weeds, so I wanted to make sure I'm doing it correct. Thank you for your guidance. I have not had my coffee yet, but as we come upon the Supreme Court hearing the controversial Texas law, as we come upon the filing period for the Missouri State Legislature, it bears reinforcing our stance as both a legislative body and as a city in support of reproductive freedoms. I want to continually bring it back to reproductive freedoms because it's not only abortion, it's one's access to sexual and reproductive health care. It's one's fundamental constitutional right to make a decision about their bodies. And their protections from the federal government and state and local governments from making one decision or the other. It is a two-edged sword. So with that, I'm very excited to hear input and answer questions from my colleagues and also from the public. So with that, Madam Chair, I do yield back.
Alderman Stevens, would you like to have the speakers that you had sign up speak first, or would you like to go through and have the board or the members of the committee ask you questions?
Well, I would defer to you, Madam Chair. I don't know how, I don't know if you have any preference one way or the other, or if any committee members have a preference, if they'd like to hold off until last, or if they would like to go first. I'm really open to anything so long as everyone's given a chance to speak. So
Okay, great. We will start moving through the folks who have signed up to speak for Resolution 141. The first person is Maggie Olivia. Maggie, are you with us?
Yes, I am. Thank you.
All right. I just have to do a quick affirmation. Do you affirm that you will tell the whole truth and nothing but the truth?
I do.
Okay, please proceed. You have 3 minutes.
Thank you. Thank you so much, Committee Chair Alderwoman Ingrassia and Vice Chair Alderwoman Middlebrook and Alderman Rice, Gunther, Martin, Green, and Todd for being here today and hearing my testimony. Again, my name is Maggie Olivia. I use she, her pronouns, and I'm here today in support of Board Resolution number 141, Declaration of Our Fundamental Reproductive Freedoms, introduced by Alderman Stevens of the 12th Ward and Alderwoman Tyus of the 1st. I am an abortion storyteller, a city resident, and the brand new policy manager for Pro-Choice Missouri. Pro-Choice Missouri, formerly NARAL Pro-Choice Missouri, is the leading grassroots pro-abortion advocacy organization in Missouri with a 52-year history of fighting for reproductive freedom. Pro-Choice Missouri is a 501c4 nonprofit organization dedicated to building and sustaining a constituency that uses political processes to guarantee reproductive freedom for all. As we speak this morning, at this very moment, in our nation's capital, the United States Supreme Court is hearing arguments in the Mississippi case Dobbs versus Jackson's Women's Health. This case was designed to fundamentally alter, if not outright overturn, the scope and protections of Roe v. Wade. This case will determine the future of abortion rights and access in Missouri and across the nation. If Roe does fall, anti-abortion politicians have set up so-called trigger bans in 12 states, including Missouri, that would immediately criminalize abortion. Simultaneously this morning at our state capitol, anti-abortion extremists in the General Assembly are able to start pre-filing legislation in order to further restrict our reproductive autonomy, freedom, and justice. These extremists have proudly boasted their intentions to push for devastating abortion bans like those we have recently seen move through the state of Texas and even more recently, Ohio. State restrictions on abortion have already made it virtually impossible for entire communities to access abortion services simply because they're struggling financially or they're forced to travel extreme distances. All of these restrictions are about controlling our bodies and making it harder for people to access essential healthcare. These cruel and dangerous restrictions fall the hardest on people who already face systematic racism and inequalities, including Black, Indigenous, Latinx, Asian American, and Pacific Islands and people of color, those who have to work to make ends meet, the LGBTQIA community, immigrants, young people, and people with disabilities. Our most fundamental freedoms rely on our ability to make personal decisions about if, when, and how to grow a family, including decisions about abortion, to access accurate information about all of our healthcare options without judgment or coercion, to have safe and healthy pregnancies on our own terms, and to raise children in healthy, safe communities with the support that we need to thrive. While the battle for Roe continues on in the courts and politicians in Jeff City continue to attack our reproductive freedoms, we know that the fight for abortion rights and access is happening on the ground in the states and in local communities, and that the only way that we can win is from the ground up. As politicians in Jeff City ramp up their racist anti-abortion agenda, advocates and policymakers in St. Louis can take bold actions to protect abortion and help people and their families thrive.
Hey, Maggie, you're over time. Can you wrap up quickly? I'm so sorry.
Oh yeah, absolutely. This is just a really unique opportunity to advance reproductive freedom, and Pro-Choice Missouri really urges you to move this resolution forward out of committee, and thank you again so much for your time.
Thank you so much, Maggie. Dr. McNichols, are you on the line?
I am. I echo Maggie's thanks to the committee for allowing me to testify.
Hold on for just one moment. I'm so sorry. I just have to swear you in quickly.
Oh.
Do you affirm that you will tell the whole truth and nothing but the truth?
I do.
Okay, thanks, Dr. McNichols. Please proceed.
You bet. So thanks again to the committee for hearing my testimony. Good morning, everyone. My name is Dr. Callie McNichols, and I am a board certified OBGYN practicing here in the city of St. Louis. I'm also the Chief Medical Officer for Planned Parenthood of the St. Louis region and Southwest Missouri. Specific thanks to Alders Stevens and Tyus, as well as many of you on this community for introducing Resolution 141 and for providing me an opportunity to vocally support the measure by sharing some of the difficult but really incredible and rewarding work that I get to do caring for your constituents. I've spent most of my adult life dedicated to improving the health of Missourians, and that is really something I consider a privilege. I'm proud to say that I provide a broad spectrum of reproductive health care, which includes abortion. As you heard from Maggie, Missouri is one of 5 states in the country in which there is only 1 abortion clinic left. That health center is located here in St. Louis. What does that mean for us? Well, RHS, or Reproductive Health Services of Planned Parenthood, is the last stronghold in the fight to keep abortion accessible within our state lines. We know that the vast majority of Missourians are already fleeing the state to ensure access, and this is a reality that really no Missourian should find acceptable. Since 2001, Missouri politicians have enacted several dozen medically unnecessary abortion restrictions that have legislated or regulated abortion out of existence for most people, especially those of low income, those in rural communities, and those who are Black and brown, already navigating racist and discriminatory systems, trying to access basic health care. You know, in many ways, and specifically here in Missouri, we see over and over again that we are already in a post-Roe reality. More than 1.3 million reproductive capable Missourians already have limited access to this care. Across the US, 15 anti-abortion laws stand just a single step away from the Supreme Court. And if Roe should fall, as was alluded to today, 26 states, which encompass more than 36 million people, including Missourians, stand to lose access to abortion. We know what's at stake should abortion access go away. The Turnaway study is a recent longitudinal study on the effects of being denied an abortion. It found that significant financial, family, and health consequences when a pregnant person could no longer access the abortion that they needed. People who are unable to receive an abortion are more likely to face increasing poverty, bankruptcy, debt, and lower credit scores in comparison to those who were able to access the abortion they needed. In addition, children born prior to the pregnancy in which pregnant people seek an abortion, excuse me, and the child born as a result of being denied the abortion face significant increased challenges, including more likely to live in poverty and having worse developmental outcomes. I see this every single day in the patient interactions I have. Parents trying to do the best they can for the kiddos that they already care for. We must face this reality. Access to safe legal abortion in many parts of the country, including most of the Midwest and South, will likely be eliminated in the coming months. I assure you, no matter what happens, we will continue to fight. But I urge you too to show up for the millions of people in Missouri and across the country who soon will also lose access to abortion. In this dangerous moment, St. Louis can and must lead. Please pass Resolution 141 and declare that St. Louis is a reproductive healthcare safe zone. I appreciate your time.
Thank you so much for being here today. Alderman Stevens?
Yes, thank you. I just wanted to state for the record that Alderwoman Tice and I both worked on this and worked on the language and whatnot. And I think Madam Clerk might be confused why the previous 2 speakers have spoken to Alderwoman Tice's involvement. And that is why I need to, excuse me, I need to get a glass of water. I need to confirm with the clerk that her name is on the resolution. But that is why the 2 previous speakers have spoken to Alderwoman Tice's involvement. So I just wanted to state that for the record. Thank you, Madam Chair.
Thanks for the clarification. Catherine Betts, you're up next.
Hi, thank you.
Do you affirm that you will tell the truth and nothing but the truth?
I do.
Thank you. Please proceed. You have 3 minutes.
All right, thank you. Good morning, and thank you all for having me. My name is Catherine Betts. I use she, her pronouns, and I am an 8th Ward resident. I work in communications at Washington University School of Medicine, and I'm also a volunteer leader with Pro-Choice Missouri. I testified today to urge members of this committee to stand up for reproductive freedom and support Resolution 141. I have worked closely with Pro-Choice Missouri volunteers to speak with constituents across St. Louis about the Reproductive Freedom Bill of Rights, which inspired today's resolution. Over the past several months, myself and fellow Pro-Choice Missouri volunteers have spoken with thousands of voters at their doors and at public events about the reproductive healthcare needs and the support they need from our local leaders to have those rights protected. In our conversations, we found that people all across St. Louis, from Princeton Heights to Old North, enthusiastically supported the values expressed in today's resolution. When I would talk with city residents about reproductive freedom, I experienced a real readiness to engage. People spoke in personal terms about their needs for their health, families, and community, including better education and awareness, increased access to contraception and abortion, and more support for families so they can raise their babies and children in healthy, thriving environments. Residents were also scared that their access to reproductive health would soon be jeopardized in an unprecedented manner. In particular, they expressed fear and hopelessness about the lack of control over what happens in Jefferson City and at the US Supreme Court, where decisions about our most personal healthcare needs are made by powerful people who we don't know and who don't know us. Although we are currently facing a dark moment for reproductive healthcare access in our state and in our country, residents were eager to find out ways that city leaders who they trust could stand up against these attacks. They felt represented by city leaders and wanted St. Louis government to be a bold champion for reproductive freedom. Today, the Supreme Court begins hearing arguments in Dobbs v. Jackson Women's Health Organization, a case which could fundamentally alter access to legal abortion in our state. In the face of these attacks on reproductive freedom, city residents are eager to know that they are not alone and that city leaders are standing with them. I urge you to take action today and send a strong message to everyone in Missouri that you support our most fundamental rights and freedoms by supporting Resolution 141. Thank you.
Thank you so much, Catherine. I'm going to run through the committee to see if anyone has any questions or comments. Alderwoman Green.
Thank you, Madam Chairwoman. First, I want to apologize. I keep losing internet access this morning, so I've been going in and out of testimony quite a bit. I just want to thank everybody who has come out and testified today, and thank the alderman from the 12th for bringing this forward. I don't have any questions today, but do think that this is a very important resolution for us to be passing at this point in time, given both the climate in the state and the climate nationally, to unequivocally state that residents in the city of St. Louis stand for reproductive choice, that we stand with Planned Parenthood, that we are going to fight and protect our last remaining abortion clinic in the state, located in our city. So I am unsure if I am a co-sponsor on this, but if I am not, please add me as a co-sponsor to the resolution. Thanks so much.
Alderman Gunther.
Thank you, Chairwoman. Just also wanted to thank Maggie, Catherine, and the doctor that testified for your work. We're proud to stand with Planned Parenthood and they were all pro-choice or pro-choice Missouri, and happy to be a co-sponsor on this. So thank you very much for your work.
Alderwoman Middlebrook.
Thank you. I want to thank everyone for all their hard work, and I would also like to be added as a co-sponsor. Thank you.
Thank you, Alderwoman. Alderwoman Rice.
Thank you, Madam Chair. And I also want to echo my thanks to Maggie and my 8th Ward resident, Catherine, and Dr. McNicholas for testifying with us this morning. I'm thrilled with the work that has gone into this, the outreach from Pro-Choice Missouri, door to door, all of the time, talking to St. Louis residents about what matters to them, what are their biggest concerns when it comes to this area of their lives. I'm thrilled that we have that information to come back to and say we really are speaking with the support of our city residents, and so that's really helpful as we move forward in this, and hopefully that sends a message as I think the both of you who are still on here have also testified in Jefferson City for our reproductive freedoms, and that is hopefully we're a little bit more friendly faces for you to be talking with this morning. But thank you for taking that message to the state. Thank you for giving us this opportunity, Alderman Stevens, to weigh in this morning as a person who is impacted by these bans, by these laws. I come into today feeling a little helpless, feeling a little like things are out of control and there's not a lot we can do. And so having this resolution this morning does help reaffirm that there are things that we can still do here, that we here in St. Louis, we can do everything that we can to protect people who need their reproductive services. So thank you again for bringing that, and thank you for this opportunity to weigh in and just let us know what all we can do. We're here with you. Thanks.
Thank you, Alderwoman. Alderman Todd.
First of all, thank you, Madam Chair, and I would like to thank the guests and Alderman Stevens for bringing this resolution to let the powers that be know that we do support Planned Parenthood and all of its services that it provides, and the right that we do support the rights of women to choose, as well as all other people that are involved. Also, and their reproductive rights. I would also like to be added as a co-sponsor.
Thank you so much, Alderman. Alderman Vaccaro, do you have any questions or comments? Alderwoman Boyd, do you have anything to add?
Yes, could you put me down as a co-sponsor?
Absolutely. Thank you so much, Alderwoman. Alderman Stevens, would you like to close?
I would, yes. Thank you, Madam Chair, members of the committee, everyone who co-sponsored today. Thank you. In summation and closing, again, this resolution, this stance by the Board of Aldermen and essentially for our city by our legislative branch of government merely reinforces our right as defined both by the Constitution, by our laws, noting that abortion is not, nor reproductive rights are themselves enshrined in the Constitution, but rather auxiliary to our other rights, being intermeshed with our other rights as outlined by the Constitution. This just reinforces that all of us took an oath upon this Constitution, upon the laws which we represent, which we enforce and which we write. And this this resolution is so much more than just one specific medical act that is within reproductive rights, justice, and bodily autonomy. And ultimately, that's what this boils down to. So I am humbled by my colleagues who have signed on today, by my colleagues who've already signed on, who've worked with me on this. And I am grateful and hopeful for your due pass recommendation from the Health and Human Services Committee. So with that, Madam Chair, I yield back. Thank you.
Thank you, Alderman. I will entertain a motion to pass Resolution 141 out of committee.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green,
Aye.
Alderman Gunther,
Aye.
Alderwoman Martin, Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Ingrassia.
Aye.
6 aye votes.
By your vote, we've passed Resolution 141 out of committee. Congratulations, Alderman Stevens, and thanks so much for the work that the folks who provided testimony do every day. All right, we are going to move to a discussion on winter planning. I believe the Director of Human Services, Dr. Yusuf Scoggin, has joined us. Are you ready to roll, Dr. Scoggin?
I am. Good morning. Thank you, Chairwoman Ingrassia. Thank you, all the committee members, all the persons. I want to start by saying I really appreciate the invitation. I appreciate the opportunity to serve the citizens of the city of St. Louis, particularly at this critical time where we know the temperatures will be extremely low and a threat to human life in the very short future. If you hadn't recognized the forecast, tomorrow is 71, so I would encourage everybody to enjoy the last day or so of beautiful weather here in St. Louis. But as St. Louis weather always does, it changes on a dime. and next week will probably be in the 30s. And so normally what we would do during this time is make sure that warming buses and other things are in place. But I want to start out by providing a sort of greater context around what has been in place, what's currently in place, and what will be in place over the next several weeks. And so kind of why are we in a position currently where shelter space is of major concern? It's always been a concern, as demand has oftentimes been higher than the actual supply of housing, whether that's at the emergency shelter level or as noted in the affordable housing report card that came out a couple of weeks ago, whether it's in the permanent housing setting. So when we're thinking about placement, certainly emergency operations in the winter are critical, but the flow of people into permanency is our ultimate goal. And so with that in mind, we are focused on a few things. We are still in a pandemic. The Omicron variant is certainly a concern in the national media, and I'm sure it's here in the United States and probably will be impacting our community at some point, shortly after we, of course, became aware of the Delta variant. And so that has impacted our shelter operations from essentially the beginning of the pandemic. A few things were put in place to support folks to ensure that our shelters could remain active for the safety of those we serve, as well as for those who are staffing those facilities. This work is not an easy task. It is challenging. Folks are often underpaid. And so we have to think about everyone that's involved in that equation. And so we, of course, in working with the continuum of care, our health department and medical institutions here in the region, we're able to provide support at the shelter level and other settings to ensure, particularly for congregate sheltering, that would be sheltering in which it's open spaces, people are in common rooms and common areas, that additional protocols were put in place to ensure that the spread of the virus was minimized. In partnership with St. Louis County, we're able to provide quarantine and isolation where there were exposures to particular virus while awaiting testing, or where isolation was required because an individual was positive for COVID-19. And so social distancing was required, increased hygiene, mask wearing, and all the protocols that we are all now familiar with. With that, however, that meant that we had to reduce the capacity at many of our shelters because many of the shelters are a congregate setting. They're not individualized rooms. So that led to a reduction in the capacity at many shelters, some minimal because some of them had individualized settings. But the range of reduction in shelter capacity at the beginning of the pandemic and on up to now had been fairly significant. In some instances, as low as 20% or so reduction in capacity, but in some instances, as high as 67% reduction in capacity. Why does that matter? Because we were also funding those institutions at the same level that they had been funded when they were maximally serving individuals in their centers. That was to ensure that we didn't have a collapse of those few resources. And so we know that that's kind of unsustainable from a financial standpoint. The CARES Act funding, the FEMA dollars, and now the ARPA funds are great supports, but we recognize these are temporary supports. They will not be into perpetuity. And so we do have to resume some level of capacity at our individualized shelter in a safe way over the next several weeks and months to ensure that we bring beds back online that leads to ultimate sustainability of our services. With that in mind, the good news is prior to the pandemic, we had 549 beds of sheltering, emergency sheltering space. And I just want to be very clear about things. I know when I look at some of the previous yearly reports about the number of shelter beds that are available. There's often confusion around the truth around shelter bed. And so when I speak about things, understand the numbers I give you are 100% accurate. Previous data was mixing in shelter beds and transitional housing beds. Transitional housing beds are not immediately available for folks to walk up and move into. There's a process for that. Transitional beds are being defunded by HUD, and they are limited in most part to only youth and veterans. And so when I say shelter beds, I mean actual emergency shelter beds that are accessible on any given day at any given time. And so we had 549 before the pandemic started. Due to CARES Act and FEMA dollars, we were able to set up additional spaces and beds at other locations to compensate for the reduction in the number of beds at those standardly operating sites. That allowed us to actually now have online 598 beds of sheltering available. So we actually have more sheltering beds now than we did prior to the pandemic, to the tune of about 10% increase. We still need more. And so there are a couple things that we have done in reference to that. Standardly on December 1st, overflow beds at Peter and Paul, as well as Gateway 180 are available. And so those are, Biddle House and Gateway 180. Those are currently available. And those have produced an additional 35 beds currently. We are also in conversation with many of our providers about resuming some level of capacity at their location, not full capacity, but inching up as we also are monitoring vaccination levels. We are in discussion with the health department, and will be over the next week or so, to deploy also some somewhat innovative ways to ensure that we can increase capacity through the incentive programs that are available, as vaccinations are one of our strongest tools for the protection of any of us, particularly those who are unhoused and need to be in a congregate setting for their safety throughout these winter months. So we will be focused on really emphasizing an intentional effort to increase the vaccination rate over the next several weeks to ensure we're able to expand capacity as well. So those are two different things, right? So we had capacity that had already increased subject to a number of things, additional funding that puts us in a slightly better position now than we were prior to the pandemic. We also are making the turn on increasing capacity at the given shelter. And then, of course, the big elephant dollar in the room are the ARPA funds. And that's to the tune of $43 million. We received over 50 proposals. This is the largest number of proposals for any RFP ever issued by this office in history. It also goes without saying the amount of federal resources being deployed to communities like ours is more significant than we've ever seen, and at a time where it's certainly needed. And so when we think about the use of these funds, we aren't just focused on the short-term measures, but we really want to increase long-term capacity for our services. That's a critical effort. I don't know how many of you all would like to just go out and go on a shopping spree during the holiday, or would you like to buy something that actually lasts in perpetuity? And so that's what we're really thinking about, is capacity building, sustainable efforts that really change the trajectory of our services. That's why the numerous line items within the ARPA funding that many of you all supported, and thank you all for that, are going to help to provide a number of supports across the spectrum. Again, not just at the emergency shelter level, but also all the way up to some of the longstanding challenges that we are aware of when it comes to Black home ownership, which also contributes if you're not stabilized in your home and in your community, can lead to a person being displaced. So those are a couple things. And so we have approximately over 30 proposals that we will be meeting with the PSA next week. We are trying to finalize the date so that we can make recommendations to them about what those proposals or contracts should be to support those efforts that could have immediate impacts within our winter plan. So those will bring on additional beds. The specifics on that will be covered over the next couple weeks as we get PSA approval and also start to get into contract negotiations and execution. So those are just a few of the pieces to the puzzle that kind of outline what our winter operations currently are and what they will look like moving forward. I would add that the warming bus will be available when the temperatures are freezing or below. So 32 degrees or below, there will still be warming bus operations. Again, overflow is available for walk-up starting today. And so that is accessible. And we will continue to provide that. One thing I would also say is that as the co-chair of the St. Louis Area Regional Commission on Homelessness, we all recognize that displacement of individuals, whether you have conversation with anyone who is experiencing hardship, or you look at our census data and you dig deep as to why people are moving in the way that they're moving, hardship moves around in our region. Our overall population as a region is fairly stagnant. And so this is a regional issue when it comes to hardship and experience. Many of the same individuals that are experiencing job loss are the same sort of demographic and background, whether you're in the city, county, or in many instances, Illinois and St. Charles. And the St. Louis Area Regional Commission on Homelessness really focuses on bringing together all the continua of care across the region to discuss issues of common interest and focus on common support for one another. So one of the key pieces that we're also doing this winter is discussing shared coordination on sheltering as capacity might be reached in one area or another. This was certainly beneficial when in partnership with St. Louis County and the quarantine and isolation was being provided for the entire region. And I think that is a great model for how we think about the issue and how we support people as they might present any space and place in St. Louis. And so I know that there are a number of other efforts that are taking place, and we're in close contact with the continuum of care about many of the projects that are interfacing with the hospital systems, because that is also a place of seeking refuge during the time of inclement weather. And so close contact with those parties to make sure access to sheltering is available, and not just available when it suits shelters, but also available when it may be after hours. We are required by HUD to ensure that sheltering access is available at all hours. And we have to make sure that that's in place. Those hours are often times when the temperature is the coldest, when it's late at night. And that will also help us to ensure that no one dies this winter subject to inclement weather. And so with that, that it kind of gives a general overview. I thank you for your time. I know I can be a very long-winded if you ever allow me, but I'm open for any questions and any suggestions.
Thanks so much for the presentation. Alderwoman Green, do you have any questions or comments?
Yes, a couple. And thanks so much for coming in front of us today. And it's great to see you, and welcome to your new position. I'm happy that we were able to bring you from the county.
Thank you.
couple of just questions is when we're looking at the service gap that exists, are there certain populations where there is a larger service gap, like families or couples? Are there places like that where we're having more challenges in finding shelter space?
Yeah, so Gateway 180 is primarily our family shelter. When we look at a few things when determining the answers to your question, Alderperson Green, is to understand that in 2 months from now, in February, or last part of January, actually, the last week of January, we'll be doing our point in time count. So we look at that on a regular basis, but we also look at something that is ongoing data collection, and that is our coordinated entry process that allows us to evaluate who is seeking resources, who is on our waiting list for housing resources. Hold on one second, I'm sorry. And so that information tells us that we have a disproportionately high chronically unhoused population. And what that means is those folks who have been unhoused for a significant period of time, that being 1 year or longer, or who have had 4 instances of homelessness over the last 3 years. That's the group that we would identify as chronically unhoused. Nationally, that makes up about 10 to 15% of the unhoused population. Unfortunately, here in our city, we have approximately 30 to 40% of our coordinated entry list is chronically unhoused. Many of them are those that we see out in our plaza area and sometimes throughout other divested parts of our community. Many of them are single African-American males. And so while we have sheltering for males at Peter and Paul, Biddle House, et cetera, there are some challenges around not just the number of beds being made available, but the type of services that could be housed in those places to support those individuals. Many of those individuals have co-occurring challenges, that of substance and or alcohol use. As we know, the fentanyl and heroin epidemic is unbelievable. It is taking thousands of lives in our region. And the use amongst the population that I mentioned is the highest in increase in the last several years. And so it's really about services as being rendered at those locations for the chronically unhoused, many in the continuum of care and in the outreach community, as well as in our office, recognize what we would identify as low barrier institutions are important. Settings where individuals might come to us who have needs, but are not a harm to themselves or to others needing necessarily some admission to the hospital, but need the kindness and consideration and possibly to some degree isolation, but monitoring that's required to really kind of get them to a good space. Some of these same ideals are also being thought through and likely will be deployed over some time when it comes to the sobering centers that are being discussed across the region as well, because of the same issues with the similar population. So hopefully that answers your question to some degree, Alderwoman Green. It's a whole host of issues, but it is often that single male. You know, when you think about the financials of what that looks like, oftentimes families are recipients of additional subsidies and or potentially are prioritized for vouchers with housing authorities, et cetera, because of the children involved, which makes sense. Oftentimes males don't have those same levels of support.
A couple of follow-up questions. I heard a presentation from St. Louis Public Schools maybe about a month ago or so, and I think they were talking something about 3,000 to 4,000 students that they classify as being unhoused or having housing instability, some of them that they have not been able to have contact with throughout the pandemic. Is there outreach or coordination that's currently happening between the city and the school district, the continuum of care, to kind of help the school district in alleviating some of that issue?
Yes, absolutely. So at the invitation of Chairwoman Ingrassia's, Dr. Adams and his staff there at the school district, we were actually on a panel approximately, was that 3 weeks ago now, Alderwoman Ingrassia? So we met with that panel to discuss some of the issues. And within every school district, they have what is standardly identified as a homeless liaison for students. And so that identifies, schools are required to track who is identified as unhoused. Now, their definition is slightly different than what HUD's definition is under the services and the dollars that flow through our office. They operate under the McKinney-Vento law, which counts those who are doubled up in various locations, what we would identify as couch surfing, living with family and friends. They're not stable, but they're not literally in a place unfit for human habitation. And so we are talking with them about those needs to strengthen the coordination with our office, with the continuum of care as well, to ensure that those who are needing assistance can be provided for. When I was working in the county, there were a number of school districts, as you might imagine, 89 municipalities and many, many school districts. The participation from the school districts was extraordinarily valuable for working to reach the parents oftentimes, to meet the needs of those households and to reduce the number of folks falling into shelter. One thing I did not mention earlier, in all of the resources that were kind of noted coming from the federal government, is the emergency rental assistance program. And so when we're thinking about the stability of families, children involved, we also have to think about how do we support them and identify them early and get them to the resources they need. And so the city of St. Louis has been provided and has deployed almost $9 million of the first round of the emergency rental assistance dollars. We will be receiving $12 million in the second round. The deployment of the second round of funds will be executed in coordination with St. Louis County. We will be reviewing proposals subject to that so that there's one portal that folks experiencing hardship in St. Louis City and St. Louis County are able to access. And only in the background do we draw money from the city funds or from the county funds subject to the applicant's address. That way we can communicate with one voice to people experiencing hardship. We shouldn't have to explain that if you're a city resident, you apply this way. If you're a county resident, you apply that way. That's confusing to people who are frantic and experiencing hardship. So there are a variety of tools. We also have another discussion that will be happening, I believe, in a week and a half with the school board as well to dig deeper and with action steps. Oftentimes, and I mentioned this when we met with the school board initially, was I don't like to leave meetings and it just be a nice conversation. I like us to walk away with to-dos and ways that we can actually impact the work in a serious way, and look forward to doing so with that school district.
Great. I have one final question. You know, in the 15th ward, and I know this is true sort of throughout the city, you know, we've had a very long-term encampment that here, and The folks in that encampment are not really willing to accept services at this point in time, not really willing to come in. But there's a lot of concern still about their, health and safety, especially over the winter months. What outreach is being done to support those who are not ready to come in and are not ready for housing, especially given that in past winters, that outreach has largely fallen on volunteers. And I think that volunteer network, especially over the pandemic, has gotten increasingly strained and stressed and needs support in order to continue to be able to do that amount of outreach.
Yeah, so there are a variety of things kind of in that. So there's certainly extraordinarily generous, heartfelt effort that's put forth by volunteers of Winter Outreach and many other organizations that are focused on addressing the needs and supporting those in our community. We also provide funded organizations like St. Patrick's Center to do outreach as well. We are also aware of some community groups who are funding outreach in association with funds that they might be collecting. I'll give you one example. There are special business districts and community improvement districts throughout St. Louis, some of which also recognize that things aren't just about beautification and law enforcement from a security standpoint, but also connecting those who are in their community who might have needs to the resources. And so in the Central West End, that led to the hiring of Alvin Ferguson, who was a longtime employee doing outreach with St. Patrick's Center to do outreach all throughout the Central Corridor. The reason I mention that is because outreach has to be coordinated. There are funded parties, there are unfunded parties, there are new parties that are coming online, and we all have to be talking so that we don't duplicate effort and no one runs out there with a Christopher Columbus mentality, right? Because there aren't, as you mentioned, Alderwoman Green, there are encampments that we're well aware of, and we need to make sure that we aren't duplicating effort and we're reaching folks. But we also need to never give up on folks, because just because they turn it away today doesn't mean that something won't change their mind. And so we'll be looking at those encampments as well as the outreach when we're talking weekly on our outreach calls to identify what outreach is being done, where are some challenges, what additional resources might be needed. We do supply many of the outreach bodies with a variety of supplies, including blankets, cleaning supplies, other care packages, bus tickets, et cetera, as necessary. We know that some of those organizations, the process probably could be improved. So we're looking to sort of tweak how high of a threshold it might be for some of these smaller organizations to be able to gain access to resources, to go out and quickly obtain various things. As you might recognize, the pandemic has hit us with a number of issues around the supply chain issues, right? And that's impacting governments as well. Yet down the street at Walmart, you're able to get everything you need. And so how do we tweak our system so that we're not caught up in the sort of bureaucratic hurdles and allow those who are out doing the work to easily and quickly access things? So that's something that's also another thing that we're looking to change to support people.
Wonderful. Thanks so much. I'm going to follow up with you on offline with a couple of specific things, but thank you so much for your time today. That's all the questions that I have.
Before I forget, I just wanted to interject that Alderwoman Green, you're probably familiar with the new Board of Education Legislation and Advocacy Committee. So they reached out to me, Matt Davis did, and I was able to invite, we had members of the COC, Dr. Scoggin, somebody from Covenant House, come to talk to the district. And I encourage all of you who are able to attend that update meeting. We got an invite for the morning of December 11th. So we can hear about the 3 legislative priorities that the Board of Education has identified to work on. Alderman Gunther.
Thank you, Chairwoman, and thank you, Dr. Scoggin, for being here and a very detailed report. Very good. I just had a couple of very kind of simple questions. So you said that the warming buses are going to be starting up. Are the warming buses only going to be located downtown, or is there an effort to maybe have warming bus locations, maybe south side and north side as well?
Right now, we have them scheduled to be downtown. However, in that outreach component that I was mentioning earlier, we do look to make sure that transport is coordinated in some of those outreach efforts to ensure that folks aren't sort of stranded and without access to our various shelter opportunities.
Okay, so we'll get information about transport if we find someone down on Jefferson and Chippewa overnight, that we could get transport for them.
Correct. We'll work with outreach and whatnot to ensure that that happens.
Okay, wonderful. And then the only other question I had, you had mentioned that of the 50 applications that came in for the expanded services, that you have about 40 you're going through now. Are we looking at using the recreation centers again?
So the recreation centers, without speaking for the proposals specifically, the recreational centers are actually being utilized. So it made it easy. This was the case in the county as well. When everything was closed down, no operations were occurring at these various sites, it was easy to use those sites. Now those sites are being utilized for other purposes. So we don't anticipate the recreational centers will be likely used this year. We're looking at the proposals as well as maintaining the beds that we have online at these other spaces where I don't think that necessarily will be required.
Okay. All right. Thank you very much. That's all I had.
Alderwoman Middlebrook.
Thank you, Madam Chair. Thank you, Dr. Scoggins. At this moment, I don't have any questions. Thank you.
Alderwoman Rice.
Thank you, Madam Chair, and thank you, Dr. Scoggin, for the update. I am glad to see, real numbers about the number of shelter beds that we have available, the overflow beds, and just seconding the question about the warming bus. So is that a 24-hour warming bus, or is that just during the day? Could you just be a little bit more specific about that?
Yeah, it's just in the evening. So it starts at 5 o'clock and will run up until 8 o'clock or so. And this is to ensure that there's a place for folks to keep warm. As we know, temperatures tend to start to drop as you get into the evening, as well as to support transport to various overflow sites. As you know, one of the key pieces that I did not mention is that there are additional sites that will be operating this year in coordination with Winter Outreach at various sites on various days, as many as 40 to 60 beds on any given night, and in some instances more. And so, but their temperature thresholds are 25 degrees without precipitation, with precipitation, or 20 without precipitation, which is less than freezing. And so what we want to make sure is when those conditions are being met, that we are coordinating with them to transport folks from that site to those various locations.
Okay, and I wonder if there's a way to put together a map or something, having those resources at hand for us when we get phone calls to say, hey, here's where, I know that having a coordinated entry is helpful, but even when you're having a discussion with someone and you don't know where they could potentially be sent to, right, at least having an idea of where sites are available. And then, if sites need volunteers or donations or that type of thing, having that kind of information would be really helpful.
there's currently an app being used called
great.
Get Help that has been helpful for real-time bed availability.
Okay.
I haven't gotten super deep into the details of it to know its public-facing elements
Sure.
for others to kind of tap into where things are. But as I learn more, I'll certainly share. And I'm sure all Chairwoman Gracias is aware of it as well to some degree.
Great. I'm so trying to figure out, well, have we hired for those new outreach worker positions that were created? Are those filled yet at this time?
Those social workers, so the 15 social workers, 3 of which will be supervisors of 4 of the 3 teams. So there'll be 4 team members with a supervisor assigned to each. We plan to deploy them in not just the same way that I think they were initially designed. So when think about the unhoused situation, we have to think about it from two perspectives. One being that we want to address the needs of those who are emergently in need, right? And those have already been identified. We also want to stem the tide and the flow of folks into homelessness, right? And so rental assistance dollars help. We also have to identify what are other pipelines into homelessness. I think one of the conversations we're having is discharge planning with hospitals, discharge planning from penal institutions or jails. Also, what is our discharge level from our housing authorities? This was something I worked with Susan Rollins, who was a previous executive director for the housing authority in the county. They were able to reduce their terminations from housing vouchers by about 80%. That was extraordinarily beneficial because, as you might imagine, anyone who is receiving a housing authority voucher, if they're terminated from that voucher, they're extraordinarily likely to fall into homelessness.
Right.
And so the use of these social workers, I think, will be used to support efforts to also stem the tide of folks falling into homelessness, to address some of the critical needs as we identify populations who are the most likely to fall into homelessness as well. They have not been hired quite yet. We're working through that process, but that's sort of the strategy for the use of those members. They will also be located in various parts of St. Louis, both central, north, and south, to support the needs of a variety of things that are required in our community.
Okay, that's great. And that was going to be a follow-up question as well. As we had worked down here on the south side with trying to have a social worker, someone who was coordinated through the city, an outreach worker or social worker, hopefully a combination, but be located in our neighborhoods so that they were servicing a whole area, so that they knew the folks that were coming, that there was trust built, and that there are resources available. And we'd worked with the public library down here on South Grand as, a potential office space for that person to locate out of and that kind of thing. And I would love to see that. I mean, the idea there was to try that in our area and then hopefully roll that out around the city. And it seemed like a great option. I'm not sure that we ever actually got it off the ground, but I'm glad to hear you saying that there will be folks located in different parts of the city, because I think that's really important for those folks to know the area that they're serving and the people that they're serving, and for those people to have a face that they recognize, and for residents and businesses around to have someone that they know that they can call, who understands what's going on and who can be that connection to resources. So that's all great news. Keep us posted on that too. Thank you.
And I'm glad you brought up the library system as well. They are a critical resource. They have started opening up their services again. I met with Waller, the head of the St. Louis library system, to discuss partnership. There are a number of efforts that we engaged with the county library system as well. Kristen Sorth out there for the emergency rental assistance program, the food distribution program. They're going to be instituting social workers that the library pays for in the county. I think there are a variety of ways where we can use these sort of institutional, long-standing stakeholders to support the needs of the communities in which they are occupied, right, and in which they're located. And so, I met with Waller week 2, week 4, because again, the library system is a vital piece to this. It could also do other things such as encourage literacy amongst our young people and all the rest. So definitely.
I appreciate that too. And that was one of our struggles last winter, was that the libraries were not open for folks to be in and stay warm during the day. So I'm hoping that they will be open again for patrons to be able to be inside. So thank you so much, Dr. Scoggin.
Alderman Todd?
Well, I don't have any questions. I just want to thank Dr. Scoggin for the in-depth report and his sensitivity toward the unhoused people. Again, Dr. Scoggin, we are very lucky in St. Louis to have you as our health director. Thank you very much.
Thank you, Alderman Todd. I appreciate it.
Alderman Stevens, do you have anything to add? Okay, thank you. Just a couple of quick follow-ups. You mentioned that the warming bus would be available when the temperature was 32 degrees or below, and unhoused individuals are used to it starting regardless of temperature on December 1st. So has that been communicated to folks in terms of ensuring that they're able to access the accurate information?
Yes, that's been communicated with outreach, coordinated entry, our United Way partner as well, to make sure that clarity around that is being provided to all folks who might be looking for services. Again, the key piece is access to shelter, however, from an overflow perspective, is available now.
Okay, great. And yeah, is there, never mind, I don't need to ask that. Can you let us know who's on the Public Services Agreement Committee?
Yeah, there's the PSA.
Yeah.
I'd have to, you caught me on that one. And it's video that I don't remember everyone's name.
Sure, no worries. Would you just at your convenience email it to me? And
Absolutely.
I'll speak to members of the committee. Okay, and then let's see here. Can you just speak a little bit towards what we can expect with the allocation of the ARPA funds, like additional beds, tiny homes? Can you just remind us what we're going to be, how we're going to be expanding with that money?
Yeah, so and I'll just give it like full spectrum. There's $2.5 million for mortgage assistance. We have heard many express that they've fallen behind some point during the pandemic on their mortgage. We don't want folks to lose their home. So that's a key element. Obviously, there's information about the direct payment assistance of $5 million. Information has been issued about that and access. And of course, the unhoused have access to those resources as well. We have a process to do so. There are emergency shelter dollars that are going to support making sure we can maintain currently what we have and expand on new beds. As you mentioned, Chairwoman, there is a new thing that has come to our community, and that is the tiny home project that started on January of this year, that has been operating exceptionally well with a great organization, the Magdala Foundation, in providing 50 units there. We look to expand that as it has been a great operator and has proven beneficial to those being served there. We have what is known as safe havens, and that titling, if you look it up according to HUD, is different than what we're kind of envisioning it to be. The simple way to think about it is a low barrier sort of setup where there aren't a lot of restrictions or barriers to folks being able to just seek refuge. We're really focused on meeting people where they are, as the church would often say, to support their needs and work with them as they kind of work through many of their struggles. We also have what are called safe outdoor spaces, otherwise known as intentional encampments. Certainly controlled environments with the proper supports under the proper conditions can be beneficial, as has been described in some other communities. Certainly, it has to be professionally operated, and so we will be evaluating proposals for that as well. And then we also have what's called bridge housing. So the bridge housing effort is really to look at those who are short-term displaced, but have a housing plan to essentially provide a sort of that bridge of a week or two of assistance, possibly in hotel, motel, et cetera, until their unit is potentially ready. As the eviction moratorium has expired, we are monitoring the eviction data on a weekly basis to identify how people are being impacted and how we might attack the issue. And it varies. So the bridge dollars will help us to address some of those needs. But additionally, some of the data is really instructive about what is the state of evictions as a whole, not just from the sheer number of people or households impacted, but what landlords are evicting at a high rate. What are the circumstances surrounding these issues? What communities are being impacted the greatest? How does that interrelate with building code violations on particular properties? There are a whole host of things that I think we will learn through this process that will allow us to target and be much more strategic in our efforts, and therefore a lot more efficient and impactful. So those are sort of the broad array of services that this $43 million will help us provide for our community.
Great, thanks so much. And what is the estimated time for making those decisions on the applications and getting those dollars out?
So the first 33 or so will be put forth to the PSA next week, as long as we can get this. I need to check my email, see if everyone else has put in their specific availability. And then the next grouping, over 20, will be forthcoming to the PSA probably a week or so later, a week or two later. But certainly our desire is to make sure that those recommendations are made prior to the holiday. And then we will enter in, after that PSA is agreed to recommendations, enter into the contract negotiation and execution. We'd like for operations to start as soon as possible. What we do know is, briefly looking at some of the proposals, not all of them identify as bringing on services immediately. Some of them anticipate bringing on services in March. And so we will encourage organizations to bring online proposals as soon as possible, and certainly will make considerations most primary for those who are looking to do so.
Great, thank you so much for your time. Does anybody have any follow-up questions before we let Dr. Scoggin go? All right, thanks so much for your time today. I really appreciate it.
Thank you all.
All right, Alderwoman Rice, would you kindly take over as chair for board bills?
Yes, I will. All right, so next up on the agenda, we've got Board Bill 98. Is that the one you want to start with?
That would be great, thanks.
All right, you're recognized to jump in.
Thank you. Board Bill 98 authorizes the health department to accept a $10,000 grant from NACCHO to build the readiness of the city's medical reserve corps that will help them continue responding to the COVID-19 crisis. I do have one small change, if the clerk could let me know. I think because this bill got introduced a while ago, on page 1, line 12, there it states acting director of the Department of Health. Is it possible to just strike acting, since we have a director of health now?
It is.
Okay, thank you. Appreciate that. And I have Craig Schmid and Justin Hauser with the health department. I don't know which one of you, or if both of you wanted to speak on this, but please go ahead and do so.
So, Madam Chairwoman, members of the committee, I am happy to speak on it, but I will let you know that Justin Hauser is the individual who has more knowledge, so he will be presenting this, I think, yes. And to start off, in addition to thanking you for hearing this, I just wanted to make sure that you knew that we were thankful that you had already passed an earlier measure with regard to some $5,000 of funding through Ordinance 71355. And this is some additional funding for the pop-up vaccination clinics. And Mr. Hauser can fill you in more on the details. Thank you.
Thank you, Craig, for the introduction. Good morning, Madam Chair, members of the subcommittee. Justin Hauser, City of St. Louis Department of Health, just to offer a brief view into the $10,000 budget that has been approved by the National Association of City and County Health Officials. The $10,000 award is broken up. There is about $866 for administrative costs and fees. This is for the staff time as well as the fiscal management of the grant and funds. There are also around $1,000 in the professional services fees. This is identified for retention of a venue and hosting of trainings specific to COVID-19 vaccinations. We also have some uniform items and other equipment for badging, identification, as well as 2 AED units. The total is around $7,834 for these uniform items, equipment, and resources. And then there's $300 identified for parking, for attendance for the Medical Reserve Corps members to participate in the training that will be conducted. There are 2 trainings that are scheduled, and this will allow some flexibility for the MRC members to attend these COVID-19 vaccination trainings. With respect to time, that was a brief summary. If there's any questions, I'll be more than happy to answer or provide additional details at this time. Thank you, everyone.
Thank you, Justin, and thank you, Craig. We will go through the committee and see if folks have any questions. So let's see, Alderwoman Middlebrook, do you have any questions? Or I think she had to jump off to streets, actually. So let's see, Alderwoman Green.
No questions at this time, but thanks so much for coming today.
Thank you.
Alderman Gunther.
I have no questions either. Thank you very much and appreciate the work.
Thank you.
Great. Alderman Todd.
I don't have any questions. Thank you so much for coming. You're doing a great job.
Great. And then I don't have any questions myself. Thank you so much for all of the great work that you've done, that the health department has done, and looking forward to approving this. So at this point, I will entertain a motion to pass Board Bill 98.
So moved.
Second.
Sorry, I should have clarified with a do pass recommendation. All right, Mr. Clerk, could you please call the roll for us?
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd. Alderman Todd. Okay. Chairwoman Ingrassia.
Aye.
Alderwoman Martin. Alderman Middlebrook. You have 5 aye votes.
Great. And with that, we have passed Board Bill 98 with a do pass recommendation. And we will move on to Board Bill 135. Alderwoman Ingrassia.
Thank you, Madam Chair. Board Bill 135 authorizes the Department of Health to accept an $89,000 grant from the CDC to develop a social determinants of health plan. And I do have one Scrivener's error on this one as well. On page 1, line 15, we just need to take out the S on plan of action. So I think that can just be a Scrivener's error. And then we have Craig and Justin with more specific information.
Yes, Madam Chairwoman, members of the committee, thank you once again. I want to reflect a little bit of all the work and the fact that this committee, the Health and Human Services Committee, is so much a microcosm of what's going on in our community and so very important. Today, you've been talking about women's health issues and the health of their children. You've been talking about housing issues. And now we're talking about other, additional social and structural determinants of health, one of which is with regard to food and nutrition. And so often we're not thinking about those things. We have these supply chain issues, and the supply chain with regard to food. I know I don't need to tell you all about this because you live with it every day, is so very important. This particular grant opportunity will not solve all of those problems, but it allows us to work with some of our collaborative partners to really develop what might be determined, if we were talking about highways, as a shovel-ready project. So we have within this grant dollars that will be available for us to value the input through focus groups and surveys of people who are in the heart of our community, our residents, who are struggling with these issues on a daily basis. We like to think, those of us in public health, that we have all the answers, or at least we know all of the problems. And yet, to really truly know that and to develop a plan that is going to be functional and one that we can implement and is ready to go, we really need to tap into that resource to really determine what are those issues, what are some of the things that our community really thinks that they already have, what is it they want us to build upon, and what are some of those gaps, and how do we address those. Part of this will also involve working with our one of our many great academic institutions, St. Louis University, who has been doing some work in this area. We will also be working, as I said, with the collaborations that currently exist, one of which I want to point out is Evolve, which is elevating voices of leadership vying for equity. They have developed a tool that could be used in terms of determining what sorts of access we currently have in some of our corner stores, convenience stores, that sort of thing. Part of this will be looking at innovative solutions. So while we have definitions from the Department of Agriculture about low income, low access areas within our community, we don't really determine what some of the other areas, such as farmers markets, that might be available, those corner stores that could be beefed up in certain ways to try to bring more access to food as well. I kind of skipped over the fact, I assume that we all sort of know the level of the problem in terms of food deserts and in terms of not having the appropriate nutrition. According to Feeding America from 2019, it's estimated that 15.8% of the city's population is food insecure, and 67% of those persons are eligible for supplemental nutritional assistance programs. Childhood food insecurity was even higher at 23.4%. There is so much intersectionality between all of this, and we have witnessed and experienced a lot of this with regard to COVID in terms of the chronic conditions of diabetes, cardiovascular disease, heart disease, and all the other issues that provide some difficulties for people recovering from COVID and the like. So this would allow us by September 29th of 2022 to have a plan that's been developed truly with the community involved, truly based on research background, and have a plan that's shovel ready and hopefully fundable based on the fact that we are dotting our I's and crossing our T's, and you're giving us this opportunity to accept this funding for a plan that can be implemented within the community to continue our efforts with regard to chronic disease in the city of St. Louis. Thank you.
Thank you. We will go through the committee and see if any folks have questions. Alderwoman Green.
No questions, but thank you for that thorough breakdown. Appreciate it.
Thank you.
All right, Alderman Gunther.
Also, thank you for that breakdown. And if it's okay with the sponsor, I'd like to add my name as co-sponsor. That's all.
All right, Alderman Todd.
First of all, thank you very much for your thorough explanation. Also, I would, if it's okay with the co-chair, I would like to be a co-sponsor for both of her bills.
Great, okay. And let's see. So I did just have a question. What does the what does the community outreach portion of this look like? So if we're developing a plan with the community, what does that specific outreach look like?
Okay, so some of that outreach is going to be developed when we do our work with St. Louis University. We will be looking with the Institutes of Public Participation as to what our collaborative partners are already doing. Certainly, we'll be looking at some of those areas that have already been identified as low income, low access areas, so that we're making sure that we get input and review from those areas. We don't know exactly what that will look like. We want to make sure that we're not presupposing what some of that will be, but it will be in those areas, likely on the north side and the southeastern parts of our city, where many of those issues with the social and vulnerability indices of scores are not good. And we want to make sure that we're connecting all of those issues with regard to those social and structural determinants of health to the extent that they impact food access and nutrition.
Sure. Okay. That makes sense. I just thinking about, some of the other ways that we've done outreach, and just wanting to be as comprehensive as possible with all of the different entities that are working with food access in the city already. Like, there are so many different food pantries, and the schools, as far as what they've, and especially I'd imagine after COVID and the meal distribution that's happened with COVID, that they've really gotten some better data, maybe with families that they've interacted with, and churches that were doing food giveaways and things like that. So if there's any way, I think that the Board of Aldermen can be helpful there, because a number of our members were involved with those giveaways, and so I think that's always good to tap into those resources as well. So maybe the less established, but established but less formal, that type of thing.
Yes, absolutely right. And thank you for that. I did want to point out when you talked about that, one of the things for this plan is not only looking at that, obviously, to build upon what we currently have, but also look at a more durable supply chain. So like a one-time giveaway at Thanksgiving or Christmas or whenever it happens to be, is helpful, but not reliable. And so the data is very helpful, but then trying to make that more durable going into the future and sustainable.
Sure. Yeah, that sounds great. Okay. Well, I think that's the end of my questions. I would be happy to be added as a co-sponsor as well. I think this is good work. And with that, Alderwoman Ingrassia, do you have anything else to close? Sorry, you're on mute.
Thank you. I just would appreciate due pass recommendation from the committee.
All right. I will entertain a motion.
Could I be added as a co-sponsor too? Thank you.
All right. I will entertain a motion on Board Bill 135. I'll let you make it.
So moved.
No, that's not. No, you have to make the actual motion.
I'll entertain it. Okay. I make a motion to approve Board Bill. What number is this again?
135.
135 with the due pass recommendation.
Second.
All right. Mr. Clerk, would you please call the roll?
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingrassia.
Aye.
Alderwoman Martin. Alderwoman Middlebrook. We have 5 aye votes.
All right, with that, we've passed out Board Bill 135, and I will turn the meeting back over to Chairwoman Ingrassia.
Thanks for your help, Alderwoman Rice. Does anyone have any announcements? Mr. Clerk, if you would please excuse Alderwoman Martin for necessary absence, and I will entertain a motion to adjourn.
I move we adjourn.
Second.
All in favor signify by saying aye.
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 Have a good day, everyone. Thanks for all your time.
Thank you.